Hello, and welcome to the Holistic Fitness Podcast, where you'll learn how to get your goals without burning out. I'm your host, Laurie, and this show isn't just about movement and nutrition. You probably already know that exercise and nutrition is important for your mental and physical health and well-being. It's also about stress management, mindset, shedding those limiting beliefs, and working through some of that childhood trauma while you're at it. Today, I'm joined by Dr. Sapna Shah-Haque, MD. Sapna is a board-certified internal medicine physician. She was born and raised in Kansas, attended medical school at the University of Kansas School of Medicine. She completed her internal medicine residency at KU-Wichita. I had a friend that went to this university and I always struggle with the pronunciation.
Yeah, it's
Wichita. Help me out.
Wichita.
There we go. That Australian accent. After experiencing burnout yourself, Sapna, and watching other physician colleagues burn out, it became a passion of hers to look into different aspects of burnout. While the system does need to change as it's broken, this podcast is a way to reach physicians and possibly shed some light on what is not an isolated solution. Great. So it is awesome to have you here today, Sapna.
Yeah, thanks for the opportunity.
And I know you have your own podcast as well, which you help physicians with this as well. So you're obviously extremely passionate.
Very passionate. It's a passion project that was born during the pandemic. And, we can get into that story later on, but yes.
Yes. And that's exactly how we start. So I always ask the question of tell me about the context that I need to know about your life to know why you help people in the way you do today.
Sure. So that could be a very long story on how we got here, but I've been burned out twice myself, but it really wasn't. I didn't have the language to really describe that until 2019, 2020. And how I came to that was, unfortunately, my best friend from medical school and residency, who is also a physician, died from suicide. Mm. So when that happened, it was just.
That would have been so hard. The closest I had to a dad passed from suicide as well. And it's a really tough situation to go through. So firstly, I'm really sorry you went through that.
You as well, because it's you wonder what could anything have been done to prevent it?
Exactly. Yeah.
And so I started reading, there's this context of once you hit a certain milestone in life or a certain income, or you have a certain accolade that you achieve, life should be perfect. That's what we think. But we have to remember, this is not a fairy tale. This is not a Disney movie. It's real life, and life is hard. Mm. So no income, no title, no accolade gives you protection from something bad happening or being in a bad spot. Exactly. So I was surprised when I started reading about, what is the physician suicide rate? And this was pre-pandemic. It was about 400 physicians per year here in the States. Wow. And then the burnout rate, women have a higher burnout rate than their male physician counterparts. And, it wasn't until then that I started reading about that I had verbiage to describe what I had been feeling in 2016, then 2019. Mm. And then about close to a year into the death anniversary, I didn't know how to process it. So I sought counseling. Mm. And about a year after that, I started the podcast because I saw more and more of the moral injury and burnout coming to light during the pandemic.
It's so wild to me that people who give so much of their lives to others, especially throughout the pandemic, we saw it, doctors and nurses.
Yeah, everybody,
Yeah, everyone in the medical field give so much of themselves that they're so burnt out. There's nothing left for themselves. And it's really sad that someone can feel so stuck, 400 per year, that the only way out is to be physically out. Yeah. That hit me really hard. So I guess like you have a really strong reasoning as to why you help people in the way you do today. How do you help people like move out of that? Like, what have you seen is the best way to help somebody go from feeling burnt out to being able to manage their circumstances rather than needing to run or escape?
I think the first thing really is to know where you're at, like know where you are at in life, and know if you are disconnected from your normal self. For example, before going through burnout, I myself I'm pretty easygoing. Not much bothers me usually. I mean, if I feel passionately about something, I'm going to speak up. But don't sweat the small things. I usually like to be around family and friends, and with my close circle, I love socializing. When I hit the wall of burnout, I didn't want to socialize. I wanted to be left alone. When I got home, I didn't even want to talk to my dogs. Like, that's how fried or done at the end of the day that I was. And to not want to talk to a dog is kind of silly, but I mean, they're
I feel that though.
But they're one of the sweetest beings.
They're the best. Yeah.
Yeah. So how could you not want to talk to a dog? Or, greet them as eagerly as they greeted me.
Yeah, that's a pretty good indication that you're getting burnt out.
Yeah. And it was related to work, and it was related to just situation. And then when I couldn't fulfill some of the family obligations that I wanted to fulfill, such as my mom had a large stroke back in 2016, and there was some pushback when I wanted to go see her. Mind you, I'm in the same state, but not in the same town or city. I got some pushback. And so I didn't see her until she was being dismissed from the hospital. And we've got to do better. And nothing should really keep you from seeing your family like that.
Yeah.
So that's when I decided enough is enough. I'm going to change my priorities. So to answer your question, I think that you have to understand what your priorities are, what your normal area of being centered and focused looks like, what is your authentic self, what are your values, like what are your core values? And once you define those, if what you're seeing in the mirror is not reflecting that, then you need to pick one thing, just pick one thing, focus on it, and try to change it. Every little bit of change to that, to recenter yourself, to become the more authentic self. I think that's the key, because we can't change the world. We can't change society. There's corruption. There's here in the US, we put money before people's health.
Yep.
It's disgusting.
Yep.
But just because, as a physician, I practice in it, and you practice in it as well as with what you do, in a different aspect. It doesn't mean that we endorse it, but we also understand that there's a need. And so if you come at it from, this is what I will do, this is what I won't do, these are my boundaries, and this is why, I think you can navigate through something as hellacious as that.
I've had a friend who's just left the medical industry because of what you just said about money before health. I don't think it's just isolated to the US. I just think the US they don't even pretend to hide it with kind of healthcare and stuff like that. In Australia and New Zealand, there's free healthcare, but their healthcare is pretty horrendous unless you pay for it, to be fair. Like, you've got to wait a long time and stuff like that. And yeah, my friend, she actually left. She was feeling so burnt out, like not treated very well, and seeing a lot as a money grab rather than genuinely treating people. So she left it, I can't say that she was burnt out. It was her experience, but her way of getting out, instead of doing what you've mentioned of defining your core values, setting boundaries and stuff like that, she actually left, which was sad.
That's not an uncommon phenomenon, unfortunately. The what I described about the suicide rate, it's also seen in the UK, I believe, Australia. I don't know about the statistics in New Zealand, but also in Canada. So I think what you're talking about contributes to all. And yeah, the thing is that you can leave. And that's for anybody that is in a career or an area in life that does not fit like who you are at your core value. At your core, it does not meet your core values. This is where moral injury comes from, right?
Yes.
If it doesn't, if you can't look at yourself in the mirror, you can leave. You can leave and choose to do something else. I mean, you may not be able to do it at the drop of a hat. It might take some planning. That's the tough thing about being an adult, is having to figure that out.
Yeah.
But you can have a plan to make a shift.
Yeah, that can be translated to any industry as well. While medical professionals, they do have a high rate of burnout, which makes total sense. I can't imagine the stress. I've given CPR two times, well, almost 3 times, but 2 times, once on a 6-year-old child. I was so messed up after that situation. Like, I don't know how people do it every day. So to me, maybe I'm too emotional. I don't know. But I couldn't handle it. But just being in business and seeing how tired people get, women specifically, sometimes you do need to take a good hard look in the mirror and decide, like, is this actually what I want for myself? Am I feeling fulfilled? And having that courage to set up an exit plan.
Oh yeah, and this is, like you said, this is for any field, because if our basic human needs are not being met, and I don't mean food, shelter, water, clothing, and all that. I mean respect. I mean happiness. I mean safety, and that includes psychological safety. And not a toxic work environment. Then start writing down, and again, just plan it out. Look at what is your next step.
Yeah.
Because nobody on their deathbed that I've read about, that I've encountered, say that they would have ever worked. They would have loved to work more.
Yeah, I bet.
So, I mean, why are we? I know that things are hard right now with inflation, and everything's getting tougher. But at the same time, I think it's looking at what can we give up, what can we substitute, what is really worth spending our time in front of the television or in front of the computer, the cell phone. That also, I think, what's my point with that? How are you spending your time? What are you consuming? If you can consume and binge watch Netflix, fantastic, that's fine. But if that's all you're doing, reshift some of that energy to, why am I doing this if this is not normal? What else can I do to fill in these needs? What are my deficits? Is it that I'm not embracing my spiritual side? Am I not embracing my physical side? Am I not sleeping well? What is my stress level? And where is that stress coming from? What can I decrease? What can I do to increase my happiness, or what can I do to refill my cup? Because the truth is, we deserve to be happy. And how each person defines happiness is up to them.
I'm really curious, like when you're burnt out, and you may know this firsthand. Personally, I've been burnt out before. Like when you're burnt out, you want to do what's easy because you're working so hard at work. So yes, for me personally, I didn't want to do the things I love doing, and I just wanted to scroll or watch Netflix or do something to numb. So how does one begin to take action when they're already just like so tired? It's so hard to imagine like doing something new, you know?
Oh yeah, and that's the reason why I brought it up, because I stay up late 2, 3 o'clock in the morning watching Netflix, and I don't even remember the series I was watching. The whole point. I mean, I would come home, I would get I couldn't fall asleep or whatever. I think for me it was when it started to affect my mood. I started getting even grumpier. I started getting very annoyed. So for me, that's what it was. I'm like, this isn't right. Something's got to change. And I actually went to my doctor and said, "Hey, this is going on." And it was always stress, right? It was always stress. And well, it is a type of stress. It's particularly burnout is particularly related to the work environment. I think it was just talking with my physician, honestly. And sometimes it is as easy as talking to a friend, talking to a therapist, a life coach. I'm Catholic, so in the past I've also talked to a priest, the family priest, that has been very helpful. So, but having that way to communicate, but I think first off, you have to try to identify what or why is going on. And sometimes it might be an external person that brings it to your attention. That happens too.
Are you tired of constantly feeling burnt out while trying to achieve your goals? Do you find yourself struggling to maintain motivation and productivity over long periods of time? I'd like to introduce you to the Goal Getting Journal, the ultimate solution for those of you who want to surpass their goals without burning out. Our journal is designed to help you set achievable goals, track your progress, and maintain a healthy work-life balance. With our journal, you'll discover practical strategies for managing stress, staying motivated, and avoiding burnout, including time blocking, habit stacking, and so much more. You'll also learn how to prioritize your tasks and maximize your productivity so you can get more done in less time. The Goal Getting Journal is perfect for anyone who wants to achieve their goals without sacrificing their mental health and well-being. Whether you're an entrepreneur, a student, or just someone who wants to make any positive change in your life, the Goal Getting Journal can help you stay on track and avoid burnout. And for Holistic Fitness podcast listeners, you can get 20% off your first journal using the code HFPodcast. Go to goalgettingjournal.com and type HF Podcast at checkout to get your discount. So what are you waiting for? Order the Goal Getting Journal today and start getting your goals without burning out.
That actually makes total sense. I've actually had a similar experience where I felt a weight lifted off my shoulder once I actually shared it with somebody at work, and I did have a safe environment. And it did take a bit of planning and analyzing first, though, because I guess previously by doctors, and you're obviously a physician, I feel like it can quickly be diagnosed as depression. And especially for me, because my burnout symptoms have typically been sleeping more, and not being able to get out of bed, and all more of the depressive symptoms rather than more of the anxious symptoms. So, and I found that antidepressants got me from a 2 out of 10 to a 4 out of 10, which was great, but I didn't need them long term because it was situational rather than clinical. And I always found that really hard, but I do find similar to you, like being able to share that experience with someone in a way that you feel safe does actually free up quite a bit of energy, even though like it's not a magic pill. It's kind of weird to say, oh, chatting to someone helps, but it really does.
Well, it's that external validation. And while it shouldn't be the driver for why we make decisions, I think there's also a culture of gaslighting, isn't there? In the corporate world, anywhere, a lot of places, there's a culture of gaslighting. And if you say, I feel this way, no, you're just weak, or you're just tired, or as a woman, you're just being hormonal, right?
Yes.
That's always the cop-out.
Are you pregnant?
Yeah. Right. It's always going to be that hormonal question, or are you pregnant, or is it that time of the month? I mean, just something very misogynistic.
Yes. Yeah.
So, and I'm not saying that every place is like that, but that is a well-documented issue.
Yes.
So you have to have a safe space in order to talk about some of these things, a lot of these things, and feel validated, or at least heard, instead of having a fear of having it come back and be used against you, or you don't want to be gaslit, right?
Yeah.
And so I think that's where I'm a big supporter of therapy. I've been in therapy myself. I've also had a life coach. I think both help. And again, it's about having a safe space. And for the listeners, I don't mean that my feelings are going to get hurt easily. I mean, I was trying to work through a loss of identity because I was so wrapped up in work, right? A loss of a friend, a loss of identity, because I think it's very easy, particularly here in the States, to get wrapped up in work and just go down that rabbit hole that we identify ourselves by what we do, what car we drive. And that's truly that's not what matters.
Yeah, you're so right. We do have this like culture of productivity and how one looks to other people. And I can't imagine how difficult it would be like for doctors, because like they always say like doctors, lawyers, like the ideal profession, and then getting there and feeling unfulfilled. I feel like there's an extra layer of pressure there, which would have been hard to overcome.
There is, but I'm still going to come in the cooler weather. I am still going to wear my cowboy boots to the clinic because I'm here in Kansas and they're very comfortable.
Yes.
So I'm gonna show up that way. That's authentic to me.
Yeah, I love that.
I'm gonna show up in my leather jacket because leather is easy to clean, and it's warm. So yeah, I'm not for everybody, but I'm gonna show up authentically and we have a good time.
Yes, I love that, and I have the same, like one of the favorite churches I went to in New Zealand. The priest, well, not the priest, I guess it was like a non-denominational church. So the pastor, he wore a leather jacket and was just rocking it. Like it was awesome. Like, but also shared like, and was able to like turn scripture into like really relatable stories and stuff like that. And like whether you're into religion or you're not, like that was a really great example to me of somebody that was like completely different to what was expected, but still showed up, rocked up, and was his authentic self.
Yeah, I think you have to show up as your authentic self in life. And, in some professions, it's, I don't want to say beaten out of us, but it's you either assimilate or it's going to be hard, right?
Yeah.
And so undoing that is it's challenging, it's difficult, it's time consuming, it's going to make you uncomfortable as heck. But the truth of the matter is, do it, because that is by only pushing yourself out of your comfort zone. And the key is when you're ready, right? When you're ready, by pushing yourself out of the comfort zone and encouraging that personal growth, that's when you start getting back to who you are at the core. Your interests may change, but hopefully your 18 or 20-year-old self is not wanting to kick you in the ass because they can't. You're like, I turned out to be that. That was never my goal.
Yes. I sometimes think that about my 15-year-old self. I was very like into metal, like anarchy, like stuff the man, like, I don't like the man. And that's been a really big point for me in corporate, is to speak like who I am rather than having this corporate veil and being like, oh, let's circle back to this topic later. Not that. And if you naturally speak like that, great. Like that's not a kick in the butt to those types of people. But for me, that's not how I speak. I speak the way I do now. And yes, sometimes I don't sound educated, even though I'm pretty smart. But I don't have to speak in those huge words that I know. I would prefer to, explain it to a 5-year-old. That's just the way I am. But you do sometimes feel, I guess, in my profession, just maybe not like the smartest person in the room. But I feel like if I conform to that and conform to the man, I would just be not myself, and I would just be doing that from a place of insecurity rather than a place of authenticity.
No, I agree. I'm pretty rough around the edges. I'm not always well polished when I speak. When I need to be, I will. I can do that. Correct. But that's not every time. That's not every time you have a conversation. And, it's exhausting to be just not me.
Totally. Why do you think that, or why do you know, you might know, but why do women have a higher burnout rate? Because I see this in my profession too. With people that have communicated that are burnt out to me have always been a woman. So why does this seem to be an issue that's bigger with women?
How many times does a man have to come home and expected to cook dinner or take care of the kids?
Yeah, true.
And I'm not saying... So it's a lot of societal expectations, but also expectations we put on ourselves. Here's the thing. If you help make the kids, you can help take care of them. Pretty point blank, right?
Yeah.
Now maybe some households don't work like that, and that's fine. But you can delegate. You can talk to your partner, talk to extended family, friends, outsource what you can, meal prep. There are great things that hang in the closet, so you can get your clothes ready for like 3 to 5 days if you want. It just takes a little bit of extra prep, but it saves a hell of a lot of time during the week when you're not running around trying to find things that you can't normally find because I'm disorganized at home. I'm incredibly disorganized. Looks like a bomb went off in my house at times. But you know what? I gave up the perfectionism. Is the house clean? Yes. Are the clothes clean? Yes. Do we have a decent meal on the table? Yes. So, okay. It's not everything's picked up and tidy and it doesn't look like a magazine house. If you want that, don't come to my house. I'm pretty open about that.
I think I need to give up the perfectionist, Sapna, because I like a magazine house and put so much pressure on myself to have it. I wonder how, whether that's a female thing as well, whether you have kids or not, you just put so much pressure on yourself for everything to be perfect.
But that's the thing. It's not. And it looks like my kids live here because they've drawn on the walls. And if I want to try to take a magic eraser, they're, Mommy, why? It's the house is shiny and pretty.
Aww.
We made it that way. I'm like, okay, so it stays. They put their mark. It's their territory too.
That's really cute.
But things will get done.
Yeah.
Things will get done. But it's not going to be perfect every day. And, you can have a clean house and 5 minutes later, it's a disaster. So pick and choose your battles in life. You can either put your energy into having a dance party or spending all the time bitching and griping about, what's not picked up. And the whole point of that is you have to let some things go. And that was one of them. Before kids, it was easy there was no reason, but now it's more challenging. It's more challenging. Let's put it that way. But, these years go by quickly. So I've chosen to let certain things go. On the weekends, we pick up, and we just have a routine. Mm-hmm. And to offload some of the hustle and bustle in the mornings, they help me meal prep during the weekends. So it's just little things. It's just little things that we do as a family that help to offload some of those things. And then I outsource certain things that I feel that I would be best done that way. Mm-hmm. There's certain expectations and boundaries. So I don't know. That's helped me.
Yeah, no, that makes total sense. There's two things I kind of want to pick out of that. One, a mentor of mine, she provided a really great analogy for like the things you need to learn to let go. And she said, like, imagine all of your tasks as different balls in the air. You've got all these balls in the air. Some of those balls are rubber and some of those are glass. Figure out which balls are going to break everything and and it's exactly what you said. Like your rubber balls is like having the kids drawing on the wall or, not having all of the dishes perfectly put away. And you've really clearly defined what is not going to break you.
Yeah. Yeah. And it's going to be different for everybody.
Yeah.
But at some point, you realize that you can't do it all. And it either throw your hands up in the air and say, fuck it. Or you say, or it's going to make you curl up in a ball because you feel like a failure just because your house isn't perfectly clean.
Yeah.
Or because, heaven forbid, all the towels aren't folded perfectly. And these are real scenarios that I've heard. And when you pull it out of the closet, it's still going to be as straight or crumpled as the next one. So let some of the small things go. Focus your energy on things that matter to you. If you like perfectly folded towels, that's fine. But my whole point is, again, delegating and figuring out what is important. And so one of the reasons why women burn out faster than men is because of expectations, right? We're supposed to be super mom plus kick ass in corporate America and not bitch about any of this, right?
Yes.
And the truth of it is that's bullshit.
Yeah.
Excuse my language, but that's bullshit.
It is. Have you watched Barbie yet and seen that like speech by America Ferrera?
No, but it's on my list to do.
Yeah. Even if you just listen to that speech, because I feel like every woman listening to that is exactly what you just said. It's, I'm expected to be perfect at work, perfect at home, perfect at this. And at the end, I can't complain about it because then if I complain about it, I'm bitchy or I'm hormonal or, and it basically encapsulates in like 1 to 3 minutes exactly how every single woman feels. It was one of my favorite things. Something else, though, I'm pretty curious about is after the closest I had to kind of like a father figure in Australia passed from suicide, I did a lot of like research on depression and stuff like that. And more women are depressed statistically, yet there's a higher percentage of men who commit suicide, which I'm like, are men just not dealing with it? So I'm wondering if you have the same sort of, just hearing that women have a higher burnout rate, it makes sense that we get burnt out more quickly. But do you think that like there's some men out there suffering in silence? That's what I think, but I'm curious to hear your thoughts.
Oh, absolutely. Absolutely right. And actually, I just did an episode this week with Rakan Dandia on men's mental health for my podcast. And what he was discussing, and it's not the first time I've heard it, is if you don't want to seem weak, there's sometimes a stigma associated with reaching out. Men are supposed to be stoic and unemotional, and if you cry, it's not manly, and that's just completely not true.
Yeah.
You don't want anybody crying at just anything at the drop of a hat, just kind of out of the blue, that's a different issue. But at the same time, I think there's strength in vulnerability. And asking for help, because you have to, number one, think about how much effort goes into that. You have to recognize an issue, recognize that you as a person are not able to cope, or maybe you're about ready to hit rock bottom or whatever that is, and then that you need help. So that takes a lot of insight.
Yeah.
That takes a lot of insight. And so I think the culture around men and emotions and depression, I think that there's a stigma. As women are called emotional, men are expected to be without emotion, which is completely not true. They're human beings with emotions as well.
Exactly. Yeah.
And so, but then you also look at the methods that typically men pick to complete suicide, and typically it's more guns, something that's going to be
they'll get the job done.
Yeah, exactly. Whereas women, it's more medication overdose, and there are ways to reverse that.
Hey, Holistic Fitness fam, a quick message from one of our sponsors, NED. As you all know, I recommend good nutrition, movement, and stress management practices before supplementing, so you know what type of supplementation that your body actually needs. For me, I supplement with very few products, but NED is one of them. I am a type A, high-energy, ambitious business girly with massive goals. And sometimes I honestly just need to chill out and relax a bit. I've found that both NED's de-stress and sleep blends fit in with my busy lifestyle and ambitious goals, but I was honestly not a big fan of CBD products before trying NED, mostly because of the culture surrounding weed. I just didn't want something that was going to alter my state of mind so that I became much less of a goal-getter or less ambitious. That was until I learned about full-spectrum hemp and their benefits. NED blends are chock full of premium CBD and a full-spectrum hemp of active cannabinoids. NED's full-spectrum hemp oil nourishes the body's endocannabinoid system to offer functional support for stress, sleep, inflammation, and balance. These products are science-backed, nature-based solutions that offer an alternative to prescription and over-the-counter drugs. All of NED's full-spectrum hemp oil is extracted from USDA-certified organic hemp plants grown by an independent farmer named Jonathan in Colorado. I'm obviously a big fan, but don't take just my word for it. NED CBD products have over 2,000 five-star reviews, and they work with incredible partners in the medical field like Dr. Caroline Leaf, Dr. Christian Gonzalez, and Dr. Will Cole. NED is providing Holistic Fitness podcast listeners a very special discount. If you'd like to give NED a try, listeners get 15% off NED products with the code LaurieLee, LORILEE. Thanks, NED, for sponsoring the show and offering a natural remedy to bring balance to so many people's well-being. Yeah. Yeah. Do you think that is like because men have this more like productivity mindset of like getting the job done? Or do you think like women are just looking for a more passive way to do it? Like, I'm really curious about the psychology into that, because I hate hearing the term like, oh, they're just doing it for attention. They didn't do the job on purpose and stuff like that. And I've heard terrible comments like that. And that to me is just completely untrue. I do not think it's a cry for help. So I'm just curious, like your thoughts on the psychology behind them, like that.
I definitely think it's first access. The second one is exactly what you said. Men want to get it done and over with, right? Let's be efficient. And not that women aren't efficient. We're efficient at other things, aren't we? We're nature versus nurture, but I think that we don't want to feel the pain. Mm-hmm. And so no, that overdose is not a cry for help. That's an ugly way to say it.
Yes. Yeah, really terrible way to say it. And maybe I heard those comments earlier. when I was in my early 20s and stuff like that. And I just think it's completely untrue. We are, coming up onto the hour now, and we've spoken about some pretty heavy stuff that's needed to be said, because hopefully somebody listening, if they feel like they're in this scenario, maybe feel like they can reach out for help and intercept it early. Something you did mention that I wanted to pick your brains on is something that helped you is like stepping into your authentic self. That's helped me as well. Yeah. And defining your core values. How do you, in today's society, when we're told that we're successful if we become a doctor, all of these things set us up for success, the car, the house, all of that. How do you define what your core values are when we've been fed so much stuff?
Yeah, we've been fed a lot of noise, haven't we?
Yeah.
And I originally became a doctor because I wanted to do Doctors Without Borders, but life happened. So you know what? That's a great question. And it's to answer your question, I think, most appropriately. It took a few losses to kind of circle back to who I was originally. So it's easy to get lost in the noise, but when there's something that out echoes or outspeaks the noise that society feeds us, but then we listen. Or you can learn by others' mistakes, and that's another way to learn too. But a lot of times it's a loss or a life-changing event that makes us circle back and say, "Well, hey, what the hell?" So hopefully it doesn't take that, but I would say stop, pause, turn off, disconnect. I'm not saying necessarily go out into nature, but for me, it's going out to New Mexico a couple times a year and really reconnecting, and the drive out there, reconnecting in what I find to be my spiritual spots. I can think, okay, am I at where I need to be? Like, is my spiritual life what it needs to be? Is my is my work life where it needs to be? Is it getting too big? Because if it is, I need to shrink that. Am I spending enough time with my family? Am I spending enough time with what I love to do outside of career? And so when I call the balance of the boxes, from this concept taken from Dr. Robert Bean, and he actually goes through the pathophysiology of burnout. And so I think looking at those, for me, that has helped, because I've learned from him what he said. And then again, looking at, okay, is what I'm doing truly making me happy? And if not, why not? If so, why so? And just redefining what your goal of, or what your definition of success is, because it's not a dollar amount. It's not a house size, and it's not a car. It's not a degree. Like, the most educated person I know was a big learner in life, but had a second grade education. So screw degrees as far as making you happy. And that was my maternal grandmother. So yeah, what makes you happy? Then you have to answer that question and cancel out all the noise.
Yeah, it sounds like a huge part of it is reflection and also creating some sort of space for yourself, whether that's physical space from your environment or mental space within your mind, and like asking yourself those hard questions to kind of like figure out what lights you up. But I also couldn't agree more with regards to the education piece. Like, being a lifelong learner is so much more important than learning to check off boxes. And that's not to say somebody with a PhD isn't a lifelong learner, but let's be honest, some are doing it for the clout and for the status. So I think it's more about the qualities you can embody than the boxes that you can check off.
Exactly. Yeah.
I know you have so much knowledge, so I'm going to let you create your own question here. Is there anything that we haven't spoken about today that you really wanted to speak about in this podcast and share with people?
I think it's just that you as an individual matters. Like, you as an individual, you matter. And you really have to be able to look at yourself in the mirror and If you're happy, fantastic. If you're not, try to look at what would make you happy and don't rely on an external source. I think happiness is within you, and you really have to define that and then work toward that. It's a choice. It's a choice of showing up as your authentic self. And if you don't know what your authentic self is currently, then work toward defining that. And that is going to change as you, as a person, as you change. So I think that be open to that.
That's so true. And that can trigger a lot of people that happiness is a choice, because sometimes we can feel so trapped by our external environment, but it is a choice at the end of the day. And by believing it's not a choice, you're further trapping yourself in a situation because you're removing that autonomy from yourself.
Exactly.
Thank you so much for being so vulnerable today, Sapna. I've really enjoyed this conversation. I want to go on a bit of a run and reflect after this conversation. I just your depth and your energy is just really powerful. And I'm sure other people listening have felt that. So how can others get in touch with you, learn more about your work, and continue to be inspired by you?
Sure. So just go to my website, theworthyphysician.com. And there it has links to blog posts and free resources and podcast.
Awesome. Great. Theworthyphysician.com. We'll ensure that's in the show notes. Once again, thanks so much for joining the show today. I've really appreciated having you on.
Thank you very much. It's been a pleasure.
Absolutely. And for everyone listening at home, in the car, wherever you're listening to the Holistic Fitness Podcast, eat well, move well, breathe well. And until next time, keep shining.